Hey, what's going on? I'm Dr. Leila Hariri, a family and cosmetic dentist for more than 22 years. And you're listening to Ask Dr. Leila. Anything you need to know about dentistry. We're going to talk about teeth, prevention, oral health, and tons more. So relax, listen, and smile.
Hello everyone, my name is Farwad Afrasiabi and today I'm joined with Dr. Leila Hariri. This episode on Ask Dr. Leila will be quite different to the normal ones where she talks about dental information and advancements in the dental industry. Today it's all about Dr. Leila. She will be talking about her journey with her clinic that she built from the ground up. As you may know, Dr. Leila is the CEO and owner of Leila Hariri Dental and Medical Aesthetics, a dental clinic that she opened from the ground up 4 years ago after practicing in the heart of Dubai for 15 years. This podcast is dedicated to looking back on these years and forward into the future of this business to give you guys an idea of why it is so successful and what key traits a dental business should prioritize. Please introduce yourself, Dr. Leila.
Thank you, Farwad, for a wonderful introduction. I'm delighted to share why I chose this path to all of you and to be able to give you key information about the clinic. One thing to note, though, is that the clinic is an extension of myself. I have reflected my qualities and traits onto this very clinic and have built a loving team with amazing patients from the ideas that have prospered throughout my life. It has truly been 4 of the most chaotic, stressful, yet rewarding years of my life. So where should we start?
Well, firstly, let's start in chronological order. When did you decide that you wanted your own practice? Was it always at the back of your mind, or a more recent idea that changed the perception of what you want your future in the dental space to look like?
I have always seen myself opening my own practice. The entrepreneurial mindset feels embedded within me. My dad was an entrepreneur as I grew up, and I have always seen myself to be one too. Since graduation, I set myself the goal that I would be part of and leading a beautiful and sincere clinic. Every day was leading towards this vision. Every day I gained experience and knowledge in dentistry that would make me one step closer to achieving this. It took time and effort to come to where I am now, but I could not be happier.
And is this determination that I see in you part of why this clinic came to life?
Yes, it is. And I realize that hard work is a very cliche topic nowadays, but I stand by it. More than ever before, people are looking for the quick and easy paths to great success, and the popularization for get-rich-quick schemes are evidence for that. However, I have valued my relentless rigor greater than anything else. Personally, there is no shortcut to the life we live. Here and there, one may seem to find their own path and cut some corners, but in the grand scheme of things, it is a long-haul journey of great effort. I believe that to start a clinic, one must first have a strong determination to do so and have the work ethic to strive above the hardships.
I agree with you too, though I must say, in my eyes, starting a business, whether dental or not, takes a level of madness. It's such a huge risk no matter who you are, so I must ask, how do you justify it? And give us an idea as to why you went along this path.
Firstly, I give my thanks to my loving patients. They gave me the confidence that I needed. To start any business, the entrepreneur has to have full confidence in their business, as doubts are like cavities. You should first acknowledge and find them to see if it is a valid issue, then get rid of it with the filling to prevent it surfacing in the future. In similar ways, my patients were so supportive of me and my future. They wanted me to prosper too, and I do have to give credit to them for pushing me to do the things the way I felt right. As I mentioned at the start, this clinic is an extension of me and the beliefs I have in dentistry too. Number 2, I learned from other businesses, especially because I'm proud to say that before opening this clinic, I stayed in one clinic for 15 years, right here in the heart of Jumeirah. And in that lovely clinic that I learned the do's and the don'ts of management, of so many things. And I think I gained my basic knowledge of how I want things to be from just staying in one place. And then I remember I had great ideas, but like anybody, I'd like to say differently. I'd like to say that for me, I value everyone's ideas, and not only value it, but I actually want them to implement it if it's for the best of the clinic. First, always comes patients for me, then the clinic, then everybody who's working in the clinic. So as long as we keep that as priority, I want people to share their ideas and we incorporate it. But I felt that working somewhere else, I couldn't do this. So that also gave me great motivation. And of course, leverage. As I am getting older, not younger by the days, I see that in the future, maybe we'll have a junior Dr. Leila coming in, that I can give her or him my expertise and let them flourish. And I'll be here side by side when needed, but there's certain things that maybe won't need my special skills, and the younger crowd can maybe even do it better. So these are all my reasons for doing what I did, Farbod.
Yeah, it's so nice to see your lovely incentives to start this clinic, and clearly what your vision was came true to life, because if you look at this clinic right now, it's just lovely. Now, I would also like to focus on the clinic. What themes have you implemented to this clinic that you feel are of the utmost importance for any other clinic to replicate?
Full honesty and clear communication with patients. For example, if a patient asks me for full mouth veneers, and I believe he or she can achieve good results with ortho and whitening, as I've mentioned on many podcasts and videos, and as I mentioned daily to patients, I prefer that that's what they do. And I say, if really veneers are your thing and I don't feel you're a candidate, I won't do it. Also, I share my recommendations clearly, but really listen to their response. Relentless attention to details of patient experience. OCD, as my patients call it. On making sure we strive to give a 5-star patient experience to each and every patient. Really, at the end of the day, no matter where we go, I think you all agree it's the experience that matters. It could be a restaurant, even the food may not be so amazing, but it's really what we walk out, the feeling we get by the people that served us, from the chef to the servers to just everybody, all in all, from the moment you walk in. And that's what we strive here in this clinic.
No, I totally agree. It's the little things, in the details is where you find the differences between each and every practice, and you guys have really strived in that category. Even I've noticed here and there just the little communication with the reception. It's just exceptional.
Thank you. That's very important for me, because that's my key belief. Patient doctor relationship. It's the relationships, and I always look at things Farbo long term, because when you look at it long term and not just that moment, it all comes back. And it's been beautiful seeing, as I've mentioned before, families that now their children that I used to see are already grown up, have their own children. So I'm feeling old, but really I'm going through generations, and that's the golden key. And also having a clear purpose and willingness to do what it takes to achieve it. I always wanted to be one of the best healthcare providers for my patients, and it has taken a lot from my personal life. That's for another topic, another day, how to balance that, if there is such a thing as balance. But listening to my patients, they agree that I have achieved it.
And what about your team? I mean, I've been in the lucky place to have met your team on numerous occasions, and I must say, they are amazing. have they played a role in how great your clinic is?
Absolutely, Farbod. Creating a world-class team of professionals to provide the best quality care for the patients is of utmost importance. Providing high quality, full range of dental care requires searching for a long time prior to opening this clinic. I handpicked, cherry picked each and every one that you see when you walk in this clinic that is working here.
And out of curiosity, how important would you say education is in the dental industry? And relating to that, where did you graduate from your dental school?
I take pride in saying I graduated from University of California, San Francisco, because it's still one of the leading dental schools of the world. And it's very research-based. It is absolutely not business-oriented. And all my professors were just top-notch. And I feel to this day, 23 years in now, almost 23 years from graduation, I have the voices of my professors still in my head. And something deep inside of me tells me that what I do daily and what I provide goes back to those roots. And it just puts the biggest smile in my heart.
That is amazing. And one day I'll be graduating from that same university too.
Hopefully. And last but not least, working hard, accepting and learning from my mistakes.
That's great. But now that we've covered what you did that was so amazing for this clinic, is it okay to touch on the things that you might have done differently? I mean, coming into this landscape that you probably didn't expect a lot of things to happen. So what things shook you and what things would you go back and change?
Well, surprisingly, I've been lucky because I had a real ideal opening from the moment we opened the doors until now, which is about 4.5 years. It's been a great journey, great adventure, but it's been truly remarkable. But looking ahead, I would like to bring more specialists, just because if the specialists are traveling or for whatever reason, as amazing as they are, but I always think that this is an industry we're in that, it's about connection and it's about the trust. And sometimes you might feel better with one person versus another. So I want people to have the options for that. So specialist and GP.
Yeah, and I remember you talking about how you prioritize the patient experience, then the clinic, then the team.
100%.
Could you elaborate on that and give any examples of where you would prioritize the patient?
So we have our weekly 5-star meetings and we have our monthly, meetings, and somehow I incorporate that triangle. Actually, it's not a triangle, but it's more or less the pyramid. And on top, it's always patients first, no matter what. Everything we do in this clinic, we have to do it based on the decision that, is this going to help the patient? And then after that, we do things that will help the clinic, that will allow for patients to have better experience as the clinic grows. And then the team. And I always tell them, if you put everything in that order, you yourself will also gain. Just have a lot of patience, but it comes. You don't even have to worry about it. If you go in that order, it's magical.
Yeah, that sounds great. And I hope everyone can learn from that too. And if everyone does and all businesses run like this, the world would honestly be such a better place. Now, what do you see the future of the clinic looking like?
Well, I've been lucky that I've had an interest of other dentists wanting to come here, but I obviously, as everyone has, a limited space at the end of the day. So it's a beautiful villa in the heart of Dubai. I couldn't have chosen a better location. And expansion within is one thing. And then at one point, possibly expanding outside this clinic in another area to bring in these amazing doctors.
How do you see managing that? Managing two separate clinics?
Well, I'll tell you, Farbod, right off the bat, I'll only be working in this clinic and in this room. I will not be anywhere else. But if I am ever going to put the LH logo anywhere, it has to have the same systematic. So when you walk in there, it has to have the LH feel. And that takes, so what we do daily and monthly here, we have to take it to any other clinic. And always remember, everyone needs to be trained and you have to invest in training.
So the same culture with this clinic and any other future branches.
Absolutely.
It'll feel really like the same.
Exactly.
What about to make it less dependent on just you so the brand can flourish in the future?
That would be ideal. So it's not just me that people come, and already I'm seeing that within 4 years of this clinic. Initially, when I opened the door, it was all about, we see Dr. Leila, and of course, when there's the trust, whoever she sends us to, there's that trust, and I appreciate that. But how I see it in the future is, again, that there will be other GPs that we have the same ideology, and it would only work if they have the same ideology, by the way, and then it wouldn't be dependent on me. And who knows, they could be far better.
Yeah, that sounds great. Thank you so much, Dr. Leila, for an amazing podcast yet again. I hope this brought to light many things that the viewers may not know. And I sure learned a lot, and I hope everyone else did. So finally, I must thank you. Do you have any final words to say?
Welcome, and thank you for having me on the Ask the Dr. Leila podcast. This was truly nice, and I hope the audience has enjoyed listening to us as much as we enjoyed doing this, and looking forward to our next podcast. Have a lovely day, everybody, and talk to everyone soon.